And I was like, oh my goodness, this thing might actually be real. Then I started to dig into the backstory of this. And there was a woman named Francine Shapiro who came up with this idea, actually walking behind Stanford in the Stanford Hills. She was a therapist, and she figured she had this idea based on the fact that she didn't feel as upset about certain things when she was walking, that this might be useful. And she was smart enough to know that these lateralized eye movements are what reflexively occur anytime we're in optic flow. We don't realize it because they're subconsciously generated and they're very subtle. But she realized she couldn't really take people walking on their therapy sessions. I suppose she could, but it's not really practical if it's raining, et cetera. So what she decided to do was to bring the eye movement component to the clinic and had them move their eyes from side to side while they would recount these traumas. And people experienced tremendous benefit. And in fact, now there's a lot of evidence to show that these lateralized eye movements really do quiet the stress of the nervous system and allow people to continue to move forward. This is probably all anchored. I go back to that story of that deer that needs something. And as it's feeling that agitation and gets up and starts moving, the movement feeds back onto the brain to quiet that stress and anxiety so it can be observant of its environment. And that panoramic mode is what we are in when we are in a position to be very situationally aware. When we're stressed, we're going to have soda straw view of the world.
Right, on one thing.
This relates directly to addiction because I've spent some time at addiction treatment clinics and talking to people in that community.